Now that we've seen what are the symptoms of heart attack, we'll try and find out how heart attack can be diagnosed. There are 3 or 4 simple methods by which a heart attack can be diagnosed. A first and the basic and the most simple test is an ECG. So any person having the symptoms of chest pain or difficulty in breathing or profuse sweating, the first important thing that needs to be done is to get an ECG done, which is a very basic test, very commonly available, and it is not expensive and non-painful test. So in ECG, a heart attack can be quite easily diagnosed. But one important thing to remember here is ECG which is taken very in proximity of the development of heart attack can sometimes be normal. That means ECG if taken within a few minutes of development of heart attack can sometimes be normal also. So it does not rule out, normal ECG does not rule out a heart attack. If there are typical symptoms that we have already seen, if there are typical symptoms of heart attack, then these ECGs should be repeated at a frequent intervals. Say for example, an ECG should be taken at an interval of every half an hour for the 2 to 3 hours. In spite of these, if all the multiple ECGs are normal, only then we can rule out a heart attack. So first, normal ECG may not rule out heart attack. So it is important for a patient to get multiple ECGs maybe at half an hour's interval. The next methodology of diagnosis is a 2D echocardiogram. Echocardiogram is relatively more expensive test compared to ECG, and you may not find it in a lot of places. Again, echocardiogram is a very good way of diagnosis of heart attack. Coming to the cardiac enzymes, that is the biomarkers. Biomarkers are nothing but an indirect indication of a heart attack. They are nothing but enzymes that are released in the body when the heart muscle gets damaged. This is a bit technical, but I'm just trying to tell you what are all the various ways of diagnosing a heart attack. Apart from this, the most important and the gold standard test for diagnosing a heart attack is a coronary angiogram. Okay, so now we'll come to the important diagnostic modality in case of heart attack, that is the coronary angiogram. In coronary angiogram, we'll exactly know or exactly be able to locate where the block is, which artery is getting blocked, and then we can establish the diagnosis of heart attack. So coronary angiogram is an invasive test wherein either through hand or through the groin a small wire and a catheter is inserted up to the blood vessels of the heart, and an injection is given into these blood vessels to look exactly where the block is. So this is a diagnostic test for exactly localizing or locating where the block is. So these are the various ways how heart attack can be diagnosed: a simple ECG, an echocardiogram, a cardiac biomarkers, and then a coronary angiogram. So these are the ways how a heart attack can be diagnosed.